Hello everybody, I'm very happy to be here today with my good friends and colleagues Dr. Shane Reti and Hariti Hapango, and kia ora everybody. Can I just say that dental health to me is a really important thing for children and actually adults too, and we often meet people who have had poor dental health and have lost their teeth very early on, or they've lost one or two teeth. It holds them back forever if they don't get help to stop that continuing. And I've also thought too, is one of the really hard things for people who have lost some of their teeth or all of their teeth is dealing with stigma around that, but also around confidence levels. And I've often met people who have that sort of disability, and the problem is that it holds them back from being part of the economy, actually getting jobs, holds them back from taking opportunities that other people have, and this is a really sensible way of dealing with, excuse the pun, the root of the issue. So we have a policy which is actually all about children's health, and it's giving a 30% increase into the children's dental health service. It's a big increase, an extra $30 million. And that is something which is going to increase the accessibility of a program that is very dear to our collective hearts on this. We've got, as we know, a dental health service for under 18-year-olds, which is already free. The trouble is there's not enough of that service available, and it simply needs some extra funding. So rather than change the whole system, we're just giving it a big 30% boost. We think it's going to be really important. It will enable about 100,000 extra children to get dental health care, which is enormous. There are about 500,000 children under the age of 18, or young people under the age of 18, and it means we've got at the moment, let's say, a fifth of those are not getting the care that they need. And there's nothing other than funding, really, and access to something that many of us were fortunate enough to have and to be able to take for granted. So that's what we're doing today. I just think it's a great program. It actually helps people to take control of their lives, get part of the economy, and not be held back by poor dental health care.
Can you just explain, it's an area that is really having, as you say, a lot of money pumped into it. Why will this extra funding help? Will it be extra hours? Will it be more staff to deal with it? And are you promising to bring those wait times down?
Yep. Do you want to just speak to that, because you've got the
Thank
details?
You. The two main parts to this program, which we have modelled on the Child Smile program from Scotland, a very successful program there. There'll be two key parts to it. The first will be supervised toothbrushing from children, and the second will be applications of fluoride varnish. Those are the two key interventions. What we're looking at is improving the number of holes that 5-year-olds have. So we want to look at the outcome measure. We know from 2018, 41% of 5-year-olds have a hole. We'll be looking to halve that as a good outcome measure in our first term. So that's the sort of outcome measures we're looking for.
What's supervised brushing?
Supervised brushing, what they've done in Scotland is for the 3 to 5-year-olds, they have volunteers or school teachers who on a daily basis supervise children to effective toothbrushing. For the older age group, they actually bring in dental therapists from the 8 to 13 and they supervise the basically daily toothbrushing. Now it is and has been done in parts of New Zealand currently, actually. We're going to expand it and make it bigger and bigger.
How many kids would be covered by the program? How many would get the dental kits, for example?
It is a dental kit. The number of children, as the leader has said, is roughly just short of 500,000, and we'll be doing a staged rollout. We would anticipate that there'd be at least 100,000 children in that first year who would benefit from this, but it's a staged rollout is what we'll be doing.
Judith Lawrence, why is there nothing in this policy for adult dental care?
Because it's a children's dental care policy.
Do you recognise that there's a real need when it comes to adult?
I certainly do, and I think you've also asked that of the Labour Party, why they don't have it. And primarily, as they say, it's about cost, but we think that if we start early with young people, we can get them on a path to taking the preventative care that actually can help them to save their teeth until they are adults. But when you look at the state of some children's teeth now, under 18-year-olds, they're not going to have the teeth for when they're adults. So we think it's really important that we start here.
Do you recognise that there is a dental emergency for adults at the moment that requires urgent?
Do you know, I recognise that a lot of people don't have the sorts of training and supervision when they're young to be able to know what to do and that they can take some measures. I also know there's a lot of people are frightened to go to the dentist, even though dentists these days have the most wonderful painkillers available. But there are a lot of people who are actually frightened, you know, adult people who are saying, I'm too scared to go, I don't want to know how bad it's going to be. And we want to actually change it so that we have people's thinking about how they can help themselves as well.
When was the last time you went to the dentist?
I actually I go to the hygienist every 4 months and I go to the dentist every year.
And what's your relationship with the dentist? I mean, do you find it a relatively painless experience?
I do, and I also, I haven't had a filling for a very long time, but I also am fortunate enough to live in an area where there is fluoridated water, which has been a huge asset to people like my son who grew up with it, and I grew up on a farm without fluoride, so I ended up with all the horror stories of lots of fillings when I was a young person.
You're aware of a pretty significant cost fee to go to the dentist as an adult?
I understand it is expensive to go to the dentist, particularly if you need work done. But I also know that that's why this is very important, that we put the big effort into children so that they understand about this.
Did you consider, did National consider free or subsidised dental care for adults at all?
We simply couldn't afford it, and I think that you can find that with the other parties as well. It is very important, though, that we start where we can make the biggest difference to people, and that is actually with their children.
Talking of affordability, have you got an aggregate figure for the total value of all National's promises so far?
Well, you'll have to wait because we haven't actually finished all our promises.
How
Thank
much
you,
are you
Richard.
proposing to spend?
Well, Richard, you're going to have to wait for the fiscal update, which we're doing very soon.
Labour has announced an early childhood education announcement this morning.
Oh,
Will
have
you
they?
pay more early childhood teachers more as well?
Well, we've already made our announcement, and obviously we think it's really important that we put the focus on having more teachers available for under twos. We think that's the priority, and of course everyone would like to see everyone's wages go up. We value the early childhood teachers, and that's why we think that we should have more teachers in there rather than dictating in terms of the wages any further.
Jacinda Ardern has come out today and put her Prime Minister hat back on and made an infrastructure announcement.
Yes.
Do you think that creates an even playing field when you're campaigning?
Well, I think that people can see it for what it is. I mean, it's always something that Prime Ministers have to deal with. How do they distance themselves from the Prime Ministerial role, the government role, from their party political? And so I think she's always got that danger that she needs to answer for. Look, I'm just getting on with the policies that we're putting out, and I'm focused on the people. I'm not trying to worry about what someone else is doing. I'm just getting on with my job, and I have excellent policies that I think will speak for themselves.
Did the government mishandle the quarantining of rugby teams?
Well, I think we can all see that there is a real problem. The Sansar event, that couldn't happen, but suddenly apparently the Bledisloe Cup can. I think it's a back down from the government. They clearly blamed the rugby union and the Sansar politics, they said, and it was really clear that that wasn't true at all. It was actually the government was incapable of being sensible and making arrangements to actually enable the Sansar events to take place. I would say a late-minute phone call to Scott Morrison, Prime Minister of Australia, begging to have the Bledisloe Cup here says it all, really. It's the Prime Minister backing down, and suddenly politics is very much part of the decision-making around quarantine.
And does that flip-flop just prove that we could have got the championship as well?
I think it's very obvious. It's very obvious to me. I can't see any reason why not. And it was very clear when the Prime Minister, quite wrongly, and used misinformation to blame what she called Sansar politics. And the rugby union was very clear. It wasn't to do with Sansar at all. It was all to do with her government dropping the ball.
Are you saying the Prime Minister lied?
I'm saying that's misinformation, and I'm saying this. I believe the rugby union. Henry, you haven't had a question?
Dentists have been calling for some kind of control on the amount of sugar that kids are drinking for many years. Even in government national supported water-only policies, but you came out against them recently. Do you see any case for reducing the amount of sugar that kids are getting through a government mechanism?
I see very little case for that. What I see is far better education for parents about what's actually in the fizzy drinks that their kids are drinking. And I also think it's really important that we have, wherever possible, fluoridated water. I'm very fond of fluoridated water. I've seen the difference between my son's teeth and my teeth at that same age. And I say this is that people need to understand that children's teeth, as dentists have been saying for many years, children's teeth do need to have some help, and that help is actually fluoridated water. When you're talking about sugar taxes and sugar on this and sugar on that, I mean, where's it going to end? Is it going to be someone dictating how many, lumps of sugar someone has in a cup of tea? I really do think that we have to back parents to make some decisions, but we also need to give them the information. I think it's pretty clear.
Specifically in schools,
Yep.
do you think kids should be able to buy soft drinks in
Do you know,
schools? Your government is kind of somewhat against that.
I'm really fond of schools and parents taking charge of their children and not bureaucracy telling them how to do that. We've seen with the government's education policy today, I mean, it's just another big win for bureaucracy, another $400 million being spent on bureaucracy instead of school buildings and special kids who have different learning needs being able to get extra help. Their focus is always on telling everyone what to do instead of just backing people to make the right decisions once they have the information.
On the
Michael
education,
Baker,
Labour says it won't
Sean
roll
Henley.
out that fees-free policy beyond the 1 year. What do you make of that?
I think this is Chris Hipkins' Kiwi Build moment. It is what they do when they want to roll back a policy because they know it doesn't work. And actually, as we've seen, under freeze fee, it's just another Kiwi Build where they promised big, they were going to roll it out, it was all going to be brilliant, everyone was going to be learning. Actually, they got fewer people into tertiary education with it. It is just a total nightmare.
Are
They
they
are
using
still keeping it
are they using COVID-19 as an excuse to cover up a broken promise?
Well, if you look at what happened before COVID-19 came along, just about everything that the government had promised that they were going to do failed. COVID-19, as Jacinda Ardern has said, that's her, she said it's going to be an election on COVID-19. I think it should be an election on broken promises, and actually that's another one of their broken promises.
Is the government
Baker and
failing
Sean
to
Henley.
apply common sense at the border?
I think the government is failing to supply, for instance, the testing that they promised us was going on. They failed to provide the contact testing to the level that they said that they were doing. They're only now playing catch up. And what I believe is obvious is that they simply couldn't do the job that they were asked to do. These lockdowns were necessary at the start, but the problem is we're now in a situation where our economy is suffering big time and New Zealanders are suffering big time. So the rugby is one thing. For some people who don't like rugby, they might not understand it. It's actually part of something that makes us feel happy when it's going well, and losing to the Aussies is never a good idea.
Michael Baker and
time.
Sean Henley have come out and said they're nervous about people being so close together on planes with the masks on. What's your take on that?
I'm not nervous about being close on planes as long as the people have got the masks on. I understand that most people, feel that they need to be able to go. I am not nervous about it, but I do wear my mask in transport where I'm sharing that transport, and I'm happy to wear the mask and wash my hands and do all the other things that I'm supposed to do. I'm happy to do that.
What about
Regardless
pressure,
of-
just on that same topic, what about pressure from the airlines on the government to make that call? Do you think that the government, the Prime Minister bound to that pressure?
Well, I think what's really clear is people are saying, well, how come yesterday we couldn't have people sitting next to us on a plane and today we can, suddenly it's okay. So I think, these are, as I've said before, it's becoming increasingly obvious that political pressure and politics has a lot to do with now what's happening. And I think we can see that everywhere. And I'd also say we are facing the worst economic times in 160 years, according to the Reserve Bank. And we do need to actually have sensible measures that work. And the number one role that the government had is around the border, which, by the way, they stuffed up.
On phase three, would you scrap the entire scheme, including the vocational education component?
Well, you'll have to wait for our tertiary policy, won't you?
But it's already priced in to scrap some of it.
Well, I think it's really clear is that it hasn't delivered what it was promised. But, it's a bit like Kiwi Build. Would we do Kiwi Build? Oh, no, we would not.
What are you expecting to see in pre-food tomorrow?
Well, we haven't got an update, but I would say that I'm expecting to see that the books are not in a very good position with the government, and I think that we'll wait and see exactly what the extent of that is. The fact that Grant Robertson is trying to talk down the economy at the moment tells us that he knows that there's something unpleasant on its way for New Zealanders, and it's all about the economy.
Now, if that's the case, how do you prevent an incoming national government from ending up in the situation previous ones have ended up with, that is on the day after they get into government, they open the books and say, sorry, all bets are off?
Well, we're pricing in the downturn in the economy, so you just need to wait a few more days before we put out our fiscal policy, our plan, and I think you'll see is that our numbers add up.
Fruit pickers have come out and asked for a bespoke isolation situation. Is that something that you would look at, given the economic benefits of it?
Well, I read recently that the horticultural industry is very concerned at what I think they said $9.3 billion it's worth to the economy. It's an enormous amount of money, and they're really worried that when they're dealing with the Ministry of Health that they're being told that, oh, just wait, when actually their fruit won't wait, and actually if it's not picked, then that can have flow-on effects for years. So I believe that the government has really dropped the ball when it comes to some of the specialist skills and specialised people who we need in our economy. But I'd also say is that people who say, oh, just get unemployed people to do it, don't understand that this is really tough work, and the people who do it are highly skilled, and they're often very, very capable of doing it because they've been doing this, coming in seasonally and everything else for years, so they know exactly what they're doing, and they turn up every day.
How does it feel to be amused for a tattoo?
Do you know what? I couldn't be more thrilled. In fact, I thought maybe I should refresh my views about tattoos, and I think it's time for a refresh of my views about tattoos. I couldn't be more thrilled. I rang Nick, the man who got the tattoo, because he emailed me to tell me and sent me a picture, and I just thought, that's fantastic. He's asked if I could turn up and sign it for him. I reckon I could.
You quite like Stephen Collins, the Bond girl.
I love it. I just think it's fabulous. It's so Honor Blackman. It's so fabulous.
Have you got any tattoos?
No, I haven't, but I think I should refresh my view about it. I'm thinking maybe I should, but probably not of myself.
If you become Prime Minister, is it a deal?
It may have to be. We'll wait and see. But it could be one of those promises I rethink in a quieter, calmer moment. But I have to say, being immortalised on someone's upper arm, I thought was great.
You know they turned down some
Turned down Todd Muller's one, yes.
Yes.
Yeah. Well, that's okay, but I guess, I'm just so happy that someone has done that. Isn't it wonderful? I mean, I get fan mail, obviously. I've never seen fan mail like that. What's that, Henry? I have a lot of fun in the campaign trail. I just want to be able to get those to public meetings again because, I love hundreds and hundreds of people there and racking it all up and having great fun. And, of course, we don't do that at the moment. So we're doing what we do. But I enjoy campaigning.
There have been reports of landlords planning to put up their rent as soon as the freeze finishes quite substantially. What do you think that's responsible behaviour?
Well, it's not really, is it? And I think that people will be very, very upset about that, and they should be. Look, the fact is we don't have enough people willing to be landlords. We don't have enough properties available for rent in the private sector, and that we need to encourage people to be landlords and to get out the private sector. But I also say I don't like rorting. I don't like people who take advantage of others in their time of need. I don't like that.
Does there need to be more regulation of property managers and landlords then?
Well, I think what we're seeing is that the more regulation is, the more the rents go up. So what we've got to do is we've got to get more people, more houses built, more people wanting to be landlords, and get out there and say, look, be good landlords, because I tell you what, otherwise, people like you in the media will expose it.
Dr. Shane, on The Nation, you were asked specifically about adult dental care, and you kind of dropped a bit of a tease saying, wait for the policy, you'll be pleasantly surprised. Did you overhype the policy?
Not at all. See, this is a signal that we're interested in dental. That's what this is, and we're starting with children first. The reality is the government had a report in 2018 reporting on dental care for adults. They've done nothing. This is a signal that we're interested in dental and we're making a start.
So both major parties are ignoring adult dental care?
At this point in time, we're sending a signal that we're starting with children and we'll continue to look further afield and further along the age.
So National will look at rolling out free or subsidised adult dental care at some point?
Won't commit to that. What I'm saying is we're looking at it. We actually already have been looking at it and we'll continue to do so. Today's announcement is a start.
You've got both. You've got two Māori MPs with you today.
Mm-hmm.
You earlier proposed that National would stand in Māori seats,
I'd like to see us do that one day.
but you're not, are you?
Well, not this time, because I was advised that we didn't actually have enough time because we haven't had candidates since, was it 2005, I think? We haven't had candidates standing in the Māori seats, and we needed to actually get the infrastructure in place, and that our Kahurangi, Group National Kahurangi, which is basically National Blue, we're actually working on putting the structures in place. I'm sure we'll be there at the next election, and I would really like to see us do that. I just think every vote is important, and it's really important to send messages that we want the votes that are there.
How effective do you think, or how effectively, and I wonder whether Shane and Hariti could answer this as well, you are communicating with the Māori community in this campaign? You getting any cut through?
Well, certainly up in Northland, I know the Māori people are feeling that they're listening to us and we're listening to them. It's always the best place to start with policy. So I believe that we're making some progress, and certainly our policies will be talking to Māori as well. So yes, we feel like we're making some cut through.
Kia ora, thank you for the question, Richard. Absolutely, of course. Both Shane and I, we're elected members in general seats. We happen to be Māori. So we represent the community, but we also come from communities that are Māori and non-Māori. And I'd like to acknowledge Dr. Hadley Reid, whose dental clinic we're at here in Cliff Dental, with his dentist also Adam here. And this is a community that's densely populated Māori. So both Shane and I, we come from grassroots. We've worked amongst our Māori communities and non-Māori communities. Of course we represent them. And we do it proudly too, don't we, Shane?
Exactly.
National supporters who are on the Māori roll, who do you feel they should vote for? And Party Vote National, obviously, but who do you feel they should get their seat votes for?
Well, I think they'll make their own minds up, and what I'd say to them is Party Vote National, please, and general seats, Party Vote National, and electorate seats national. Thank you very much.